look at impaired liver function. So the liver just is not functioning how it's supposed to. So one thing we look at are albumin and clotting factors that are going to be compromised. So albumin, that's that protein that allows for osmotic pressure in the vascular system. So, if you remember how circulation works, it goes from the heart to arteries, arteries to capillaries, capillaries into tissues through osmosis and diffusion, and then to get back out of those tissues and into the vascular system, you needed albumin to help with that pressure, pushing that fluid that way. So if you don't have albumin, you're going to have more edema, more fluid in the tissues because the osmotic pressure isn't there. Clotting factors are going to be affected. So typically in somebody that has an acute renal failure, we will see an INR greater than 1. So typically, somebody not on Coumadin therapy, a normal person's INR should be 1. Okay, if they're on Coumadin, we want their blood to be 2 to 3, maybe 3.5, depending on their problem and why they need Coumadin. And then to go beyond that, if we have a person not on Coumadin and we see that elevated INR, we know that they're in acute renal failure. Their blood is thinning, it's not clotting. Metabolism and storage of glucose can be affected. This can put a person into hyperglycemia and hypoglycemia just because the liver is the central hub of what it does with sugars. Does it make a triglyceride? Does it make an LDL? What does it make an HDL? The liver decides that. Less bile is produced, which impairs the absorption of fat and fat-soluble vitamins. So a person might also be vitamin K deficient. Which does not help any sort of clotting factor at all because we've already got an issue with the other clotting route. And then impaired hormone metabolism. So we're going to have issues with estrogen and testosterone, especially in women. We're going to see that irregular menses. The second thing I have there is jaundice. So what is jaundice? Jaundice is that yellowing of the skin and eyes. And what it means is there's a buildup of bilirubin in the system. Bilirubin is a byproduct of red blood cells breaking down. Our red blood cells last about 90 days, and after that they start breaking down. Well, then it's the liver's job and then they break down into all these different things, and one of those things is bilirubin. And then it's the liver's job to get that bilirubin and put it in the stool, to make it in a form that is absorbed into the stool, and that's what gives stool its brown color, is this bilirubin. And so if the liver can't do that, if the liver can't metabolize that bilirubin, something we start to see is the body will start to try to compensate the best it can. So then the kidneys will start excreting bilirubin. So if stool gets its brown color from the bilirubin, what do you think urine starts looking like? Well, urine will take on what they call a Coca-Cola color. It'll be dark brown, okay? That's bad. That is, there's something majorly happening with the person's liver or kidneys, and the kidneys can't do this forever. This is quite taxing on kidneys as well. So anyway, and then something else that we'll often see is people will say that their stools are white or clay colored, that they're very light in color because bilirubin's not making its way into the stool. And then we can start to see some signs and symptoms similar to that bile duct obstruction that we talked about with that cholelithiasis. You'll see that itching and things like that. Portal hypertension is the third thing I have there. Portal hypertension, this is a venous system. This is a huge blood system that is meant to go to the liver. The liver is very vascular. It needs lots of blood. It is like the central hub of cleaning out the blood. Okay, we've got the kidneys too, but the liver is going to be metabolizing the blood to clean it out. And so if you have a lot of inflammation inside the liver, then you're going to have a backup of this giant blood flow system that's trying to make its way to the liver. And so something you can see with that is something called esophageal varices. Let's see if I can move your guys' screen down. Okay, esophageal varices. These are large veins that bleed easily that are within the esophagus because there's that backup and that pressure. So sometimes you'll hear like that people are vomiting up blood, and that's a common sign of varices. These varices can also be in the rectum and anus as well, so we can see rectal bleeds. If you have somebody that has esophageal varices, we call that an upper GI bleed. And if you guys remember from last semester, what do the stools look like? Well, the stools are going to have that dark tarry color to them, right? And then there's that distinguished blood in the stool smell. Okay. And then if the bleeding is a lower GI bleed, then we anticipate that blood looking more red, right? The stool looking more red because the bleeding is closer to that site. It's not being processed in the intestines. And so, and the brighter the bleeding, the closer it is to the rectum and the anus. All right, splenomegaly can happen as well. Splenomegaly is that the blood will start accumulating in the spleen, making it bigger. Ascites, so ascites is fluid buildup in the peritoneal cavity because of this backup in pressure. It is literally fluid accumulating in that peritoneal cavity, okay? And one of the ways we can decide if it's ascites or not is we can actually just kind of really forcefully kind of push the belly on one side, and then we should see a wave-like motion throughout the entire abdomen because it's the water flowing that we're seeing, that not water, but the fluid in there that we're seeing. Another way is to listen to the abdomen with a stethoscope and move the belly tissue around, and if you can hear like the waves, then we kind of know that that's ascites that's happening. And something we have to do is measure abdominal girth. So we're measuring the circumference of the abdomen at its widest point, and usually it's like a daily measurement, because if it starts getting bigger, we know that there's an issue happening. Hopefully that those measurements stay steady or they decrease. Something else I have on here is hepatic encephalopathy. This is where, because the liver can't clear out the toxins and metabolize the things it needs to, there's a buildup of it, and it makes people confused. So we have a decrease in LOC and agitation, increased agitation, impaired consciousness. And then I have also hepatorenal syndrome, which is kidney failure related to liver and lack of blood flow, which I've already kind of talked about how closely related the kidneys and liver have to work together. And if the kidneys have to start taking up the slack, then they're going to start failing quickly as well. Something I do have as a side note on here is to know what specifically is happening with the liver, we have to probably do a biopsy, which is getting, and this will be done, by a physician, to get a sample of the cells and see what those cells are doing and see what those tissues are looking like. And because the liver is so vascular, one of our interventions is to apply that pressure after the biopsy to where they inserted the needle so that we don't have hemorrhage. Okay, this next slide, we're going to look specifically at hepatitis, which is inflammation of the liver. This is usually going to be caused by a virus, but can be caused by alcohol, other toxins, or even gallbladder disease. It is known to be either acute or chronic. People can have chronic, hepatitis, where they have hepatitis C or B their entire lives. The most common we're going to talk about is the viruses. So we have hepatitis A, hepatitis B, and hepatitis C. And then I've got those in the other slides coming up. So hepatitis A, this is spread from fecal to oral route. Usually you're going to see like a sporadic epidemic of this, meaning like all of a sudden one specific area is going to have a huge outbreak of it. Okay, and it's usually due to some common thing being contaminated with hepatitis A. Like, one example that I think about is I heard from my own nursing instructors back in the day that there was this small little Iowa town that had the local dairy treat, and everybody in this town got sick with hepatitis A. Almost everybody in this town got sick with hepatitis A. So, all these health officials come in and they're like, okay, what's going on in this town? Well, they go to this dairy treat that everybody loves and goes to, and here they're keeping their ice bucket for their slushy machine in the bathroom. And that was the source of the infection. So, fecal to oral route. It can be an STI, if it's direct contact with feces. So just so you know. And then it can happen with contaminated water, shellfish, and food as well. It is a mild or self-limiting illness that does not become chronic. The body typically can get over this. It does make a person very sick though. They start off with some flu-like symptoms, malaise, fatigue, headache, muscle aches, nasal discharge, sore throat. And then it progresses to jaundice, the pruritus. That's where they have the itching. There's no rash or anything, but their skin is itchy. And then having the clay stools, dark urine, maybe some jaundice. Already said that, sorry. And then mild weight loss, just because, they have that fatigue and malaise, they're not eating. Plus, it's a huge metabolic effort of the body to heal itself. Diagnostics, we're going to look at LFTs. Those are liver function tests, specifically ALT, AST, and bilirubin, seeing what those are doing. If those are elevating, that tells us the liver is stressed. We look specifically for antibodies against hepatitis A in the blood, and we're looking at clotting factors because we know that could become an issue with the liver being affected. Treatment, this can be prevented with a vaccine that is now available. And then it takes about 6 months for the liver to fully heal, and then fluids rest. And then when you ever have anything, and NCLEX questions like to throw this in there because they really want you to understand this, that if you have any kind of liver impairment, it doesn't matter how minor it is, there are 2 things a person needs to stay away from. Those 2 things are acetaminophen and alcohol. Those 2 things affect the liver and will compromise the liver function. Acetaminophen is key there because there are so many medications that contain acetaminophen. So it's going to be paramount that patients know they cannot take certain medications, certain cold medications even, because they contain acetaminophen. All right, hepatitis B. Hepatitis B, this is the scary one. This is the one that has high concentration levels and has been known to live for at least 7 days on inanimate objects. So just like on a countertop, on a doorknob, doesn't that sound like fun? And in a needle, of course. This can be an STI with unprotected sexual contact. People are at risk for developing a chronic part of hepatitis B. And then people can become carriers that are completely asymptomatic. We look at the same signs and symptoms that are found in hepatitis A. For diagnostics, we look for hepatitis B antibodies. Then, of course, LFTs, we got to monitor liver function, bilirubin, and then clotting factors as well. Treatment, there's a vaccine for hepatitis B, so it is very much recommended that people get that vaccination. It can be prevented through standard precautions. So if it's wet and not yours, that's right, you don't touch it without gloves on. And then good hand hygiene, right? Just in case. This is usually can be mild to moderate illness, not requiring additional medications. If you do have potential exposure, you can get prophylaxis treatment, which is sometimes even worse than I don't want to say worse than getting the disease, but it's pretty bad to get the prophylactic treatment. It can really run a person down, especially if they're pregnant or wanting to become pregnant soon. And then there are antiretrovirals out there as well. I've got them written down. Those are not something you have to know for the test, but there they are in case you wanted to know. All right, hepatitis C, I'm going to just breeze over a little bit. This is not on your exam. I've got this on a note. This is usually spread by needles. It can be an STI with unprotected sexual contact. You can have asymptomatic carriers as well. Diagnostics, looking now for the hepatitis C antibodies. Also monitoring LFTs, bilirubin, and clotting factors. This should sound familiar. Same signs and symptoms as the other hepatitis diseases. Treatment, standard precautions for prevention. There is no vaccine developed yet, and there is no prophylaxis treatment with known exposure. So there is no prophylactic treatment for this one, and it can become chronic. I am going to stop there with this one, and then we'll continue with nursing cares.